Hello, everybody. This is Laura. About 7.5 weeks in from my right arm shoulder surgery, I had a little bit of that bicep was out of position, so they had to cut it and reattach. So a little scar, but things are going great. I had my other one done, so a little bit of this reporting is maybe differences between right and left, or between people as well. I'm not sure what's driving it, but I have about 120 degrees range of motion, so I can go back to about my eye. I'm not yet doing any active type lifting my arm up on its own, for example, only from the elbow. But I can put my hair in, and this was huge, being able to do a ponytail or put my hair up in the last week or so. So huge milestone for women there. A difference between doctors is when they let you do different athletic exercises after. My first doctor, because I'm a CrossFitter runner, it's 6 weeks I could do running. Now this latest doctor thinks that the process long term heals better if I wait to do something like that until 3 months. So I was a little surprised at that, but am still moderating now my activity until I get to the 3 month point. And really now mostly doing things like fast walking, air squats, some type of sit-ups that doesn't strain my shoulder too much, and lunges are the main activities that I'm doing to keep my strength up at this time. So the other thing is you lose the sling at 6 weeks. The first time that happened on my left arm, I was so happy. I did not realize it was going to be so great to have that freedom in the arm. On the right side, it was not so much, and I'm not sure if that's because we're going through this COVID time where you're working at home, so I may not have had it on as much as I had my left arm on one, but a little less eventful this time. But it is always great to not have to deal with that. So that's just always a great thing, and I'm past that point. Then the key is not to overwork it once you get it off, and to still be careful so you don't re-injure it. The other thing that's been better with this side, and I had a different surgeon, so I don't know how much that has to do with it either, is sleep. My left side, I could not lie flat in my bed and really go back to sleeping until 7 weeks. And with this arm, even at 4.5 weeks, I could lie a little bit in bed, but elevated. Now, as of 6 weeks on, I'm totally flat. I can even lie on that side, although not for really that long. But I'm totally comfortable. I do use a pillow, so when I lie on my side, I do rest my arm on a pillow still to keep it up, but totally no issues with that, so my sleep's way better. It was sometime around 6 weeks, maybe when you get that sling off, you realize like you can put your arm out a little bit out of, not to, a little bit out from your side, so tying your shoes gets better. I can put on tighter shirts now with my own, take them on and off. And remember that old trick where you take clothes off by pulling it from the back over your head with your good arm. So that's better. I even put on a sports bra that's a pullover one today, so that was surprising. I don't think I can get it off on my own, but I could get it on. Desk issues. So one thing I realized, because we are all more seated now because we're all at home with COVID versus working in the office, I had with my I had to change my seating a little bit to make sure my arm wasn't having to lift itself up. So I had to elevate my arm or elevate my computer, and little changes, an inch or two in positioning of work makes a huge difference on the amount of stress on that arm. So if you're having issues, you don't think you're doing that much, reconsider your posture at work. And I also, because I've been at home, have to make an effort of just getting up and walking around more frequently, but that's less for shoulder and more for back and posterior chain issues. So I think that's about it. It's pretty uneventful. It's a long haul to get done. It'll take 6 months until you're really starting to be able to do with weights, exercises you used to do. But the range of motion gets better every single week. I don't really have any sitting pain, and now you see an improvement every single week with little things you can do, or things that might have just tweaked it slightly that now don't. So it's all positive. Just be patient, keep the faith, do your PT in front of the TV at night, you know, do your exercises, and we're going to get there. So 7 to 8 weeks, this is where I'm at. And remember, ponytail, that's the big milestone from this phase. So take care, everybody.